Hi, it's Dr. E from themanualtherapist.com. Today I'm going to demonstrate how to improve lumbar extension if you're doing like a McKenzie MDT exercise progression and they have painful or blocked extension and nothing you're doing is helping. This is a helpful mobilization with movement that was originally demonstrated by Mulligan, and it should be 100% pain-free. So let's see Ryan's extension. It is rather on the lousy side. Not terrible, but not great for someone who's pain-free. Go ahead. So he says he gets like a painful block right there. Okay. He may be able to relieve that with 10, 20, 30, 40, or 100 press-ups, but let's just try to see if this works. So lift up your belly a little bit. You get one hand above the level that I think is the culprit. He says it's kind of painful around here, and one hand on the level posteriorly. So what I'm going to do is I'm going to do a slight compression between this hand and my hand anteriorly. So I'm going to compress P to A here and A to P on this hand, just lightly like that. I'm also going to distract. And if they have a painful block or just a block to motion, this should help. Go ahead and press up. I'll try 10 of those. And I want you to tilt your head back at the end. So maintaining the traction the entire time. Still hurt at the end? Still hurt at the end?
No, I feel the walk there.
It's magic.
It doesn't feel as tight.
So I'm applying a pretty decent compressive force interiorly and posteriorly, and also doing a pretty big traction force. Is that 10? I'm counting. Enough for me to actually start sweating. Okay, relax. Let's go ahead and retest. Better?
Yeah,
Good.
that looks better.
A lot less lousy. All right, part 2 in standing. If someone could not hold a derangement reduction in lying and they needed to have a bit more reduction force, sometimes it works a bit better in standing as they don't have to get up off the table and potentially re-derange. Again, if someone had blocked extension, go ahead and extend. Not that good, is that it? Okay, not that great. All right, so again, if you tried repeated extension in different force progressions, this is just another way to make, especially a painful block, less painful. So you can either start on the level or slightly above the level, because basically the premise would be if you were extending over a derangement, you can traction and push the superior segment that is moving posteriorly a bit over and kind of get over that deranged disc if you do follow the disc model. But either way, it works to get more motion, works to get more pain-free motion, then the patient can then do better home exercises and be more compliant. So you can start centrally for central, unilaterally for unilateral on the same side. Although you could also do the opposite side if you found that that helps. So basically, always start central. You can apply a P to A on the spinous process, either on the level or slightly above. The belt is to prevent him from falling backward as I'm going to pull back with my hips to compensate for the P to A that I'm giving. And go ahead and extend. Go ahead, as far back as you can go. Tilt your head back. Good, let's do that 10 times. Keep going. Further, 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 further. Keep going. So I'm kind of twisting my hand upward a little bit as well. Got to get out of his way. Didn't really plan out that well, this table being right here. Keep going. You can go further back than that. Come on, man. Extend. Gotta dodge some bullets later. Come on. I'm blocking your way now. Alright, I'm going to get out of your way. Good. Alright, so go ahead and put your hands on your back. Extend again. Yeah. That'd be great if they were real patients with pain. These are just students who slouch all day, so that's why it's working so well. But it also works really well I'll go ahead and recommend you do that for 3 sets of 10, just like the other technique. If it doesn't work in 3 sets of 10, then you can just abandon the technique.